Hi, folks. Well, the latest data has been released by the Office for National Statistics, and each week they release data about how many deaths that have been registered, and they go into some sort of detail about what the alleged deaths were caused by. So this week, week 17 of 2020, in the UK, the Office for National Statistics released the death rate. The total death rate is 22,371, and that's the largest recorded death rate in recent times. So extremely concerning. But why is that? Is of course the big debate, I suppose. It's 11,854 times higher than the 5-year average, to give you some perspective of just how much higher. So if you look at it like that, of 22,000, that's almost double what the normal death rate would be over the course of the last 5 years. Of those 22,371 deaths, 8,758 they recorded to be allegedly COVID-19. And I say allegedly because they are using a language where they say it mentioned COVID-19. So that means, according to their own guidelines, they say that it played some role, but we don't know what kind of role. And of course, the vast majority of those that are allegedly dying of COVID-19 have serious pre-existing conditions, mostly very serious illnesses. So there's a situation where we're not sure how many of those really are COVID-19, especially as well when you consider presumed cases without any tests can also be registered as actual deaths of COVID-19. And and I think that accounts for a smaller percentage of the total whole, but in actual fact, more concerning than that is the reliability of the tests themselves, just because they don't actually make any diagnosis of how active the actual virus is, and therefore they don't determine what kind of role, the extent that it plays in causing somebody's death or not. And so it's quite concerning. But even if we just ignored all that, and let's say we pretend that all of those deaths were COVID-19 and not caused by the other serious, health conditions that the vast majority of those also had. Even if we accepted it was COVID-19, it doesn't explain how there are a large number of other deaths. Of the 22,371 deaths registered by the ONS the last week, 13,589 were not recorded as having anything to do with COVID-19. They weren't suspected. It wasn't anything. So there was no kind of illness or testing or suspicion of it. Nothing at all. So that 13,589, that's higher than you would expect the average to be. It may not be significantly higher. It's just a few thousand higher in actual fact. So, you might say that deaths do fluctuate each year anyway. Sometimes it does go up and down a few thousand. The 5-year average, it's never static at that. It goes up and down. So you might sort of, if you accepted all those COVID-19 diagnoses as accurate, you might well then say, well, the 13,500 deaths in the UK from the last week, that could be a little unusual and a bit higher than normal, and that's not too concerning. If 11, just shy of 12,000 would normally die each week out of 67 million. Given that we're in extremely restricted conditions at the moment, less people are going out. There are less cars on the road. There are less people going out getting drunken in fights. you might assume that there were less causes or less time for incidents, less fights, less aggression, for example. Certainly the homicide rate you might expect to have gone down. So you might have expected that figure to have gone down. So what are those 13,500 people, dying from? Why is all of the non-COVID-19 deaths, why is that going up? That's certainly a concerning question, even irrespective of whether you accept the COVID-19 deaths are actually of that and not of the other serious underlying health conditions that could have easily caused the deaths alone, and also the suspected deaths. Well, the 13,500 deaths just in the last week are quite concerning. And there's a number of things that could be causing that, in actual fact. I'm going to come on to discuss what some of those are. But the other really concerning statistic that came out from the ONS during the last week reported that approximately 7,500 people that died were in care homes. And that's really concerning, that figure, because that has actually tripled in the last 3 weeks from what the normal figure would have been. So 3 times as many people are dying in care homes than would be normally reported. So, that in itself is extremely concerning. Now, why that is I'm not sure about yet. And I think I certainly want to investigate that more, because that's of a real concern, actually. If people are being quarantined in care homes, at the moment, as I understand it, visitors are being barred from visiting, as I hear about it. Only staff are permitted to go in there. They're all using masks, gloves and sanitizers, if they've got enough provided equipment, that is. And they themselves are restricting their social interactions with others through social distancing. So given all those measures are in place, how come 3 times as many people are dying in care homes than would be normal? Wouldn't there be, how come there is a catastrophic epidemic? Something serious is going on in care homes at the moment for the death rate to be 3 times the figure. Extraordinary. Well, the average death figure for the whole country is double what it normally would be, but in care homes it's 3 times as high. Is that accounted for by the alleged infection or other things that could be causing that? Well, could it be stress? Could it be not seeing relatives and depression? Could that be contributing? Could there be a number of other factors? And I would say that mental health factors perhaps are actually having an effect. And I think that there are evidence to sort of prove that are gradually emerging at the moment. I made a video the other day just giving some data that I'd gathered from various charities. The Disaster Distress Helpline, it's a federal crisis helpline in America. And they recently reported that in March they had a 338% increase in the call volume compared to February. So since lockdown, a vast number of people more are calling up the crisis hotline, and that's in America. And compared to March of last year, there was an increase of 891%. Just an incredible increase, that is. Obviously, there's a lot of people very concerned and going through anxiety, and you wonder what kind of effect that has on people. People at more risk of self-harm. People under a lot of stress might be suffering more from physical symptoms. The effect of stress on many physical conditions has been long proven, and there's a huge wealth of evidence supporting that. And we're seeing much concerning data coming out from many other charities. Domestic violence charity Refuge, for example, they've reported a 25% increase in calls to their national domestic abuse helpline. It's been reported that the number of deaths through domestic abuse have doubled since lockdown began. So there's a lot of worrying statistics like that. How are we seeing potentially an epidemic of people suffering from various mental health that are more prone to self-harm without necessary support groups. I don't know the full extent of that. Certainly, there are people calling up who are reporting concerns more. The NHS 111 service has seen calls to them increase by 400%. There may be lots of people concerned about coronavirus with all the publicity about it. But in actual fact, people with long-term health conditions, there's a real concern for them if you consider they may be going through a lot of stress at the moment on top of their illnesses. But also, of course, they may well be socially distanced more from other people. So they may well be without that support network that they may have depended upon. So that's really concerning, and what kind of effect emotionally, mentally, and physically that could be having. And could that be contributing to some of those excess 13,500 deaths that are reported to have nothing to do with COVID-19? I don't know the full extent of what the causes are. You can only speculate and look for evidence for that. Certainly evidence about domestic abuse has been widespread in different countries. We're seeing the French police reporting a spike of 30% in domestic abuse reports. And that's also being reported in many other countries too, since the lockdown's gone on. And one would have expected that. It's common sense, isn't it, really? When people are frustrated, they're cooped up in a small space for long periods of time, it's going to lead at least a certain minority of people to actions that are more harmful than they would be normally doing. But I'm not going to try and over-exaggerate the risks of that. I think there's probably only a small minority at risk of domestic abuse, but there are other groups at risk potentially of other things. Like, for example, I was talking about long-term health conditions, and the Daily Mail recently had an interesting article, and they claimed that some ambulances are being seriously delayed in their time of getting to people because they claim that people with other health conditions are being classified as category B and not as essential as those with coronavirus alleged COVID-19. So, according to the Daily Mail article, there are delays of many hours for people with serious pains in their heart and other conditions. So I don't know how accurate those are. I'm only going on the reports that I've read so far. And certainly as this goes on, the effects could well increase. And I think the Daily Mail were also speculating that there were many people that were not going up to hospital and not using hospital services because they were afraid of contracting the infection. But also what happened just a few weeks back in the UK is hundreds of thousands of appointments, as I understand it, have been cancelled. A whole wealth of different kinds of treatments for people with long-term conditions. Now, they were all cancelled because they were expecting to have a flood of COVID-19 cases. So they cleared out the hospitals. Treatments for all sorts of different conditions have been cancelled. They've been delayed without any date of knowing when that will happen. I myself, from a personal point of view, I was going to get some tests done because I've had a long-term illness that causes some aches and pains. The doctors wanted to do a scan to try and find out what that would be, but they said to me that won't happen. There will be no scan or testing done to find out what the condition is and to find out if there is treatment, because the hospitals are clearing all kind of testing of that sort. And I wonder how many other tens or hundreds of thousands of people won't be having any testing, and possibly that could lead to delays of treatment, depending on the type of conditions. So I've got a vested interest myself, as have many others, in wanting to actually have hospital appointments for tests, for treatments, for checkups, for various other appointments too. And I'm quite concerned, about how many people may be suffering with a lack of any appointments, not seeing any healthcare providers at all, possibly with long-term conditions, and with actually less people that they're seeing, with social distancing, and with possibly additional stresses that it could be under. Now, given all of those factors, we're possibly talking about a larger group there. What kind of influence could that, what kind of effect could that be having on people? The idea of not considering that, I think, is really unconscionable. I'm fortunate myself that the condition I have is not so serious. It doesn't prevent me from going out and walking. I'm not struggling to breathe, and the pains are not excruciating. They're not terrible. It's sort of fairly moderate. So I'm okay in the short term. You wonder, like with other cases as well as mine, if things are left untreated, then they can progress and get worse. And you just think, how many other people with similar or in fact worse conditions are being left untreated? It's a very concerning case, to be honest. And I'm not seeing or hearing enough concern about this being discussed, quite frankly. And I don't know why that is. I think there's a number of reasons. I think possibly many people are doing okay. Vast majority of people probably don't have serious mental or physical health issues. So it may not be concerning for them personally, although I would say that probably there are a large number of people with friends or family that may have some of those conditions and that might have some concern at least, but it may not be directly impacting on their own lives. But I would say I don't think it's that people don't care. I think it's that people also have many other things going on in their lives. They have responsibilities, children to look after. There's 4 million people that are carers for a very sick relative that they have responsibilities for, especially with the isolation and with all the stress and the worry at the moment. They may be more focused on those duties at the moment. So I can't understand that. There'll be parents that are homeschooling and with those added responsibilities, key workers that will be going out to work. And so there are various people that will have focus on very important duties that they're carrying out and maybe are not in a position to be looking at the widespread issue at the moment. And actually as well, I think there's a lot of media outlets that are simply looking only at COVID-19 deaths. I'm seeing very little articles from news outlets at the moment focusing on any other deaths except for COVID-19. And if you look at the actual statistics and go to the ONS website, I'm not making those up, they've been released just in the last day or so. And of those 22,000, 13,000 of those have nothing to do with COVID-19. And so you wonder why there's no focus on those at all. Those people still have value. Their deaths are still just as heartbreaking to their family and just as worthy of being concerned about. And that number, if we don't concern ourselves with why that is, and if there are measures that can be put in place to help address that and mitigate those risks, that number worryingly could actually escalate. And that's the real concern about that, of course. So, in terms of those figures have increased. The number of deaths in the UK has increased the last few weeks. It's likely to continue doing, but there's a real debate taking place about why that is. And I think, even people that accept COVID-19 is the cause of 7,500 people's deaths in the last week. And they're willing to overlook the suspected deaths, and also the reliability of the tests and whether the actual infection played any significant or any role. Even if you accept that COVID-19 was a factor in most or many of those deaths, still those 13,500 other deaths are really concerning, aren't they? Yes, you might expect a certain number to happen anyway as a result of illness, incident or accident, but given the nature that we're all quite restricted, wouldn't you have expected there to be less deaths potentially? Given the fact, there would be less homicides if people are going out less accidents if people are engaging in less activities. So is it a combination of other things? Could it be stress, being at home so much? Long-term illnesses, not being treated, mentally ill people, denied going to support groups. Could the social distancing measures themselves actually be a risk? And I think that's a worthwhile question to actually ask. It's not a crime to actually to look at that and to discuss the issues and consider them. In actual fact, I think it's a moral obligation for us to do that. And you can still do that while you're practicing social distancing. I'm not going out around other people. I'm respecting their own privacy and their space. I'm not invading their private space or encroaching upon it. I'm keeping the respectful distance in the queue in supermarkets. And while I'm going out in parks for my daily exercise here in the UK, I'm not going out invading anyone's space, trying to sort of sanitize if I bring up any mucus or anything. So, I'm trying to be respectful in that manner, and discussing the issues, is important because those in at-risk groups could potentially be harmed at the moment and at risk. And if this continues over a longer term, it's potential that those risks could well increase. So all the more reason that we look into doing this and to look into finding out, what are the causes of those deaths, and I would encourage others to do that too.